From Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about sleep apnea and a newer therapy being offered to help patients. Our guest today is Dr. Peter Vossler, a head and neck surgeon here in Sarasota. Dr. Vossler, thank you so much for being with us today.
Thank you for having me.
Let's start with the basics of what sleep apnea is and what exactly causes it.
All right, so sleep apnea is where you stop breathing in the middle of the night when you're, and it has to last for about 10 seconds. You just completely stop breathing. Sometimes snoring is associated with it.
And you might not know you have sleep apnea.
Most of the time, people don't know they have sleep apnea. It's their bed partner that notices it for them. They say, honey, you're not breathing when you're sleeping, and I'm worried about you.
What are some of the symptoms maybe associated with sleep apnea, or what can it cause?
So the initial symptoms, the short-term symptoms of sleep apnea are being tired during the day, so much so that you're falling asleep at your desk, or even so bad as you're falling asleep when you're stopped at a stoplight, difficulty concentrating, irritability, and some forms of depression can be associated with it. The long-term effects of sleep apnea are much more concerning. It has a whole host of cardiovascular problems. Coronary artery disease can lead to increased risk of heart attack, and different arrhythmias such as atrial fibrillation, diabetes, memory loss, dementia, and it can lead to a shorter lifespan overall.
Are there different types of sleep apnea?
There are two types of sleep apnea. One's a central sleep apnea, the other is obstructive sleep apnea. Central sleep apnea is where your brain doesn't send a signal to your breathing muscles to take a breath. The other one is obstructive sleep apnea, that's where the muscles collapse or they lose tone while you're sleeping and you can't physically get air through your throat.
And are there different levels of sleep apnea within that?
There are. For obstructive sleep apnea, there's mild, moderate, and severe sleep apnea, and that's measured by an index, an apnea-hypopnea index, and that's gauged by a sleep study. That's just overall the number of times on average you're not breathing within 1 hour when you're sleeping.
So I think it seems pretty obvious. Obviously, you want to breathe when you're sleeping,
Yeah.
But why does sleep apnea really need to be diagnosed and treated?
Well, it is for the long-term health effects that they have, such as coronary artery disease, heart attack, stroke, arrhythmias, diabetes, dementia, and a shorter lifespan.
The traditional treatment that most people know about is what we would call a CPAP. For those who haven't seen one or heard of it, what exactly is a CPAP?
So CPAP is continuous positive airway pressure, and that's where a machine delivers air through a mask to keep your throat open when you're sleeping. This is specifically for obstructive sleep apnea.
There are also lifestyle changes which can help. Can you discuss some of those?
Of course, there are, and these are always important to try before you start any type of therapy. That is weight loss, getting a healthy lifestyle such as going to the gym, exercise, healthy diet, good sleep hygiene, and by that I mean going to bed at the same time every night, waking up at the same time every morning, not eating before bed, not drinking a lot of alcohol or decreasing your alcohol consumption, stopping smoking, and not looking at screens before bed, such as your phone or television.
Let's talk about this new therapy that we're now offering at Sarasota Memorial called Inspire. What is it and how's it done?
All right. So the Inspire is a hypoglossal nerve stimulator, and the theory behind it is that when your throat collapses, it's because of lack of tone. What this device does, it gives tone to your tongue, and the tongue will protrude a little bit, means stick out, and that'll open up your throat when you're asleep. So it gets rid of the lack of tone and the obstruction and allows your airway to open up and breathe.
Is that available to every patient with sleep apnea?
It is not available to every patient. There are specific criteria that people need to meet in order to qualify for it. First and foremost, you have to have tried CPAP in the past and be intolerant of it. You just can't wear it throughout the night, so it's not effective. but you also have to have a weight that's low enough, so a body mass index less than 35, and that's your weight in relation to your height. And you have to have moderate to severe sleep apnea.
Are there any associated risks to the Inspire treatment which people need to be aware of?
Yes. Now, it is a surgery, and with any surgery, you have potential complications. There is a dissection of the nerve that goes to your tongue. That nerve does move your tongue, and so there could be some permanent injury. This is incredibly rare. I have not seen that in the literature, and I have not seen that in my own hands either. There's also a risk of bleeding and infection. You'll have scars. There's a 2-inch incision below your chin and a 2-inch incision on your chest that usually heal up very well, but these are scars that are permanent.
What does recovery look like for patients who have gone this route?
The recovery is very straightforward. This is an outpatient procedure. It takes me about a half an hour to 45 minutes to perform. People go home the same day, and they are given just Tylenol and ibuprofen for pain medication. They generally will have some ear pain and throat pain, and that's because we stimulate the nerve to the tongue when we're activating the device to make sure it works, and that usually goes away by 2 weeks. There's no heavy lifting for a week afterward, just to make sure you don't have a bleed, but there isn't any restriction otherwise. You can eat what you want, you can shower, drink, no issues.
Is there a lot of follow-up involved after this procedure?
There's not a lot of follow-up from the surgeon, but you are followed closely by your sleep doctor. And I want to emphasize that this is really important. You need a sleep doctor that can activate the device for you after it's implanted. The activation occurs 1 month after the surgery is done. So I need time for it to heal. After that 1 month period, you see your sleep doctor, and they will activate the device in the clinic. And this will stimulate it at a point where you can tolerate it. And then you try this for a month. You have a remote control that you activate every night. Usually set it on a delay of about 15 minutes or half an hour, whatever works for you to fall asleep. And then it will start to activate to stick out your tongue while you're sleeping. You want to get it to a point where you're not waking up when this happens. Otherwise, it defeats the purpose of having the device in general. But you start off with your sleep doctor to get this activated. You follow up 2 weeks later to make sure that it's working for you. They might have to titrate the settings a little bit more. And if everything's working, then they'll have you follow up in another 4 months or 5 months to do a fine-tuned sleep study. And that's where they really look at all the settings for it to optimize this for you. And the goal is to bring your sleep apnea index below into normal levels, so an apnea-hypopnea index of less than 5.
What have you seen for your patients who have gone through this procedure already? Has it been successful?
The vast majority of patients that I've done this for have seen success with this. They've had very minimal problems post-operatively. Everything they did have resolved by 2 weeks. They've been able to tolerate this, and their fine-tuned sleep studies for the patients that have gotten this have all been very favorable, either mild sleep apnea or no sleep apnea.
If someone is watching this or listening and is interested, how can they learn about Inspire, and what are the steps to get referred to a surgeon like yourself who's performing this?
So you can go onto the Inspire website, inspire.com, and they'll have information for you. It's good to talk with a sleep doctor. And we have specific sleep doctors in the area that I work with closely that are very familiar with Inspire, and those are the best ones to get involved with. There's Florida Sleep Specialists with Drs. McConnell and Dr. Agarwal. There's Intercoastal Medical Group, and that's with Dr. Quintero. And there's Lung Associates of Sarasota, Dr. Lautfi and Dr. Reddy. They can all talk to you about what is needed for Inspire. Also, they can help you troubleshoot your CPAP, see if there's something you can do in lieu of surgery. Surgery should be the last option for patients who don't want you to undergo undue risk if you have other alternatives.
Typically, to get referred to a sleep doctor, would you go to your primary care? Is that how you'd go about getting referred to them?
Yes.
Okay. And so then they might, if, as you said, CPAP isn't working, then they might refer to you.
Right.
Okay. Is there anything else of importance you think to add to this conversation, or you want people to know if they're considering this, perhaps?
I think taking a good look at your lifestyle, make sure there's no changes that you can possibly do in order to improve your tolerance to CPAP or decrease your obstructive sleep apnea in general, and then getting to the right specialist to make sure that you are optimized prior to considering surgery.
So why do you think it's important that technologies like these are becoming more widely available, giving people with sleep apnea more options if perhaps CPAP doesn't work for them?
Well, I think it's very important to have other options. Before Inspire, there wasn't another option besides CPAP, and some people just cannot tolerate it. They put it on every night and it's on the floor every morning afterward, or they're traveling a lot and they can't. They find it difficult to bring it with them when they're traveling and they're not using it as much. And there's long-term side effects of having sleep apnea. You don't want to have these, and these accumulate over time. And a lot of patients that I see have had sleep apnea for decades, and they come to me and they already have atrial fibrillation, they have coronary artery disease, they may have already suffered a stroke, and we want to try to prevent these.
Dr. Vossler, thank you so much for joining us today and answering all these questions.
Thank you very much for having me.
As always, we encourage everyone in the community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.